Hi guys, so I'm here with Dr. Aaron Barsky, who's agreed to talk to us about some of the more common lung diseases you may encounter. Hello, Dr. Barsky.
Hello.
So, why don't we start with asthma, which is one of the milder diseases we're going to talk about.
That sounds good. Asthma is a condition that affects certain people. Normally the airways don't have any inflammation or spasm, and people who have asthma, what happens is the airways, particularly the small airways, they have a lot of inflammation. They tend to spasm, and making it difficult for people to breathe, and people develop symptoms such as difficulty in breathing and wheezing. And the treatment for that is to open up those airways with a medication called bronchodilators, and for more serious conditions we give steroids to reduce the inflammation.
Great. So, moving right on, we've got another disease. It's actually kind of an umbrella disease, COPD. I know it has two types, chronic bronchitis and emphysema. Could you tell us a little bit about them?
What happens in COPD, also known as chronic obstructive pulmonary disease, typically occurs in over 90% of the people who are heavy smokers, and what they do is they destroy the architecture of the airways, trapping the air, making it difficult to expire the air, and people develop problems breathing. Treatment is, of course, to stop smoking. Some people with advanced disease, they would need chronic oxygen at home, and treatment similar to asthma with medications such as bronchodilators like albuterol that opens up the airways, and steroids to reduce inflammation. Also in acute occurrences to give antibiotics, because infections tend to exacerbate those type of symptoms. Typically emphysema is the more common, and that's basically where all the damage to the airways occurs.
And now let's talk about lung cancer.
Lung cancer, very serious problem. Two main types. One is small cell lung cancer, which is, by the time it's diagnosed, it's already advanced stage, and it's palliative treatment at that point because it's a rapidly growing cancer. And then you have non-small cell lung cancer, most commonly squamous cell carcinoma of the lung, that if identified early can be treated, possibly cured.
Great. How would we treat the non-small cell cancer?
It depends on what the stage is. For early stages identified, you could have a surgical removal of the tumor, but more advanced stages may need a combination of chemotherapy and radiation therapy.
Okay, and our last disease for today, aspiration pneumonia, which I'm sure many of our fellow classmates are going to be eager to hear about.
Pneumonia in general is usually when there's infection or foreign substance that gets into the airways that triggers an inflammatory response. Specifically with aspiration pneumonia, it's when you have patients that are unable to clear their own secretions, and they aspirate those contents into the airways, causing an inflammatory infectious process. Typically many different organisms are a culprit, because there are many different organisms that are found in the secretions. Typically, the setting is a patient who has a stroke that knocks out the centers that are making it difficult for these type of people to get rid of their secretions and prevent aspiration pneumonia. The treatment for that is basically treating the underlying cause, keeping the head elevated in these type of patients to help them get rid of their secretions. Change the posture while they're eating. All of these type of mechanical things that work against gravity to prevent the secretions and food contents from going down the airway.
Great. Well, that just about wraps it up for today. My last question for you, Dr. Barsky, is how many of these diseases have you seen in your own patients?
I've seen all of them. They're very common disorders.
Great. Well, thank you so much for taking time out of your day to interview with me, Dr. Barsky.
Thank you.
Thank you.